and then she did take the medication, right?
Yes.
And did you meet with her or talk to her before she actually started to implement that particular regimen?
I had met with her beforehand, but I was not aware of when she made the decision to go ahead and take it.
So you met her on the 15th of September, right?
Yes.
When was the next time you met her?
Can I check?
Sure, cool. Actually, you can look at anything you want.
September 28th?
And on September 28th, did you discuss with her the fact that she was afraid to take the Zoloft?
Yes.
And did you recommend that she do that?
Well, she said that she was feeling better at that point and wasn't
It's a
sure.
real easy question. When you talked with her, did you recommend that she increase or take the Zoloft?
At that visit, I don't think that I did.
Okay. So when did she actually take the Zoloft?
She told me in her October 20th visit that she had taken it 1 week prior.
And she told you that when she increased it in accordance with your instructions, she went off the rails, right?
I don't think she used those words, but she had
What words did
side
she use
effects.
for you as her doctor?
She felt awful.
Awful. Why did she feel awful? Did she have a stomach ache? Did she have a headache? Why did she feel awful?
She did have some stomach aches. She had some diarrhea and had a difficult time eating. She also had increased anxiety. She had some more depressed feelings. She had more difficulty sleeping.
And what was your advice to her as her doctor on the 28th of October, after she told you about the effect the Zoloft had on her?
I told her to stop it, stop the medication.
Okay. Now, Zoloft being an SSRI, a patient that is taking Zoloft from 0.05, we spent Friday afternoon going over the drugs, and 0.05 milligrams is the lowest dose and all that. That's the dose that is prescribed to people invariably, correct?
It goes up to 200, but that is a starting dose.
For pretty much all of you psychiatrists would agree with that, right? 0.05, right?
50.
50, okay. And you then told her to stop.
Yes.
What does it mean to titrate something?
To slowly increase the amount.
What do you tell patients when they're on an SSRI as to weaning them off the SSRIs?
Depends what the dose is. If it's a high dose, you need to slowly decrease the dose, so kind of the opposite of titration. But if it's a low dose to begin with, you can't stop it.
Are you supposed to tell a person that's on an SSRI to stop immediately or slowly withdraw from it?
At 50 milligrams, it is perfectly fine to stop it immediately.
So you didn't have any concerns at all about telling her to immediately stop taking the Zoloft. And what did you do, put her on another drug?
Not immediately.
Okay. So did she relate to you on that October 28th meeting that you had? Was it the 28th or the 26th?
I met with her the 21st and then the 26th.
Okay. Now, on the 26th of October, what did she tell you her condition was?
So she was feeling back to how she was before the Zoloft, which is not great still, and that she was considering a new medication.
So she was considering it. Did she do research on medication as to what medication she wanted to take? Is that what you're telling this jury?
She didn't specify exactly what medication she wanted to take, but that she wanted to try something else because she was still having significant anxiety.
So when you say she wanted to try something else, I'm just asking, did you tell her what you recommended she try, or is that something that she decided to do on her own?
No, I gave her my recommendation.
Okay. The only reason why I ask that is that, a lot of times people might think that she's a psychopharmacologist, that she's a heart surgeon, that she's a vascular surgeon, that she knows everything about medicine. That's not true, is it?
No.
Would you agree with me that prior to telling her to stop the Zoloft, that one of the concerns that we had is that Zoloft affects anxiety and affects sleep, and you hope that it treats the underlying anxiety by balancing brain chemistry and increasing serotonin, right?
Yes.
Is that fair? And you agree with me that it does, as a side effect, have an impact on a person's falling asleep or staying asleep as a common side effect, right?
It can happen. It doesn't happen to everyone, but it certainly happens to some. But it is temporary. That's the important distinction, is that there are many side effects that disappear entirely, and then the medicine is quite helpful for those certain conditions. Yes.
She had problems sleeping, didn't she?
Yes.
even after the Zoloft, right?
Yes.
So you, not her, you recommended a particular drug that she should take, right?
Yes.
And again, as it relates to what one would expect a young woman who's a labor and delivery nurse to know about psychiatric medication. What is methadone? Do you know?
I'm sorry?
Methadone.
I'm not sure.
How about hermababate, B-A-T-E, H-E-R-M-A-B-A-T-E? How about that? You ever heard of that?
I'm not familiar with that.
That's what's used to administer to a woman who's going through birth. You don't have an obligation to know that, do you?
No.
You have an obligation to know about psychiatric medications, though, right?
Yes.
There's a difference between what's known as nescience, which is not knowing what you have no duty to know, and ignorance, which is you don't know what you should know. Is that fair?
Yes.
So, did you ever gauge Lindsay's knowledge or ability to judge what medication would be good for her?
So that was my role.
Right.
I didn't expect her to know significantly the details about different psychiatric medications.
Is it important to know that a woman that's coming to you because of postpartum issues, shall we say, had prior problems in prior deliveries?
Yes.
And you'd agree with me that you're on the front line of healthcare for pregnant women when someone comes to see you, either pregnant or after having a baby, right?
They're usually referred by a therapist or an OB, but yes.
Okay. So being on the front line dealing with these people, and you advertise that you deal with pregnant people before they have babies, right?
Yes.
And after, correct?
Yes.
Did she have any prior issues with her prior babies?
I knew that she had had some anxiety symptoms with her prior, after her second child was born.
And that would be Dawson.
Yes.
And when she saw you after having Callan, how old was Dawson?
A few years old, maybe 2 or 3.
Did she tell you what the side effects were after she had Dawson?
She did. I did not list them because,
Sweet. That means you didn't write it down?
yes.
So what is it? Memory? We'll go by that, right?
Sorry?
We'll go by your memory?
Go by my memory about what? I don't recall exactly which side effects she said, but I recall that they were some of the very common ones, the ones that are temporary.
Hold on. You're telling this jury that you don't recall what the side effects were that she told you, but your memory is that they were general, common? Is that what you said?
Yes, because if they were anything else, I would have documented it.
How about
And
she took Zoloft? Did she take Zoloft, SSRI, after having Dawson?
I think she took it for about a week.
You think? Or she did?
She did.
So isn't that something that would be indicative of the fact that there were some psychiatric issues after she had her second child?
Yes, but she did not describe them as being severe.
Well, as a psychiatrist, can you ask her whether or not they're severe, or do you just wait for them to tell you?
Based on her description, they did not sound severe.
Tell me about bipolar. What's bipolar?
Bipolar is a mood disorder that has both depressive episodes as well as episodes of mania.
And is it your understanding that if a person has a difficult birth and in fact has some psychiatric attributes as a result of that difficult birth, that you should not prescribe SSRIs to that person because they could be bipolar?
Having a difficult birth does not, it's not a contraindication to an SSRI.
So after she had her second child, she took Zoloft, and you did not detail any side effects, and you don't remember any side effects. You agree that Lindsay had, at this point, a history of mental problems during postpartum?
She had a history of anxiety postpartum.
Anxiety to the point that it was prescribed an SSRI?
Yes.
And she also had mental problems when she came to see you, right?
Yes.
So she had mental problems after she had the second child, mental problems after she had the third child, correct?
Yes.
And you'd agree with me that this is not easy stuff for somebody to be talking about. People get embarrassed in our society if they have mental problems, don't they?
Some do.
She did, didn't she?
I'm not sure.
So, not documenting any of the side effects, Did you think it would be important to document the side effects of the drug before you prescribed Zoloft a second time? She told me that she had, you don't know, but she had side effects with Zoloft. Was it important for you to document the second time that you're giving her Zoloft?
I did not feel that it was necessary to document the specific side effects.
So if someone comes to you as a person who is in postpartum and is all the symptomology that she had related to you, that if she told you that she was on Zoloft after her second child and had side effects, you don't think it's important to document the side effects, number one, right?
It depends what the side effects are.
Which we don't know because you didn't write them down, you don't remember it.
I would have written them down if
No,
they
not
were.
what you would have done, what did you do? No, go ahead.
I would have written them down if
What did you do?
I wrote that she had side effects.
What are they?
I'm not sure.
And then you prescribed Zoloft again, didn't you, in 2022.
Yes.
You recall, in the period of September of 22, October of 22, into November of 22, that she used the word overwhelmed, told you that she was overwhelmed. Is that correct?
Sorry, which visit are we looking at?
Well, the period of time, September, October, November, she used the terminology that she was overwhelmed.
Yes.
Okay. And when you were treating her, you didn't think that she was just merely overwhelmed with 3 children. You knew she was really struggling, didn't you?
I did.
And it was at that point that you just diagnosed her with a psychiatric condition, and you prescribed psychiatric meds. Isn't that right?
I prescribed psychiatric medications, yes.
So when you prescribed the Zoloft and told her to increase it, she told you that she was having all these difficulties. You told her to stop. Did you give her therapy when you saw her?
Yes.
What did you do?
I think that I
I
provided reassurance.
apologize, but not what you think. I want to know what you did. That's why you write stuff down. So take your time and look at your notes. What did you do with this young woman for therapy?
On which day?
On what?
Which day are we talking about
When
specifically?
she came to you and told you that she was overwhelmed, and you diagnosed her with a mental illness and prescribed a psychiatric condition with psychiatric meds, what therapy did you give her? Because you told us that when you're on the television, you still give them therapy too, right?
I do.
What did you do?
Well, I'm having trouble identifying exactly when she said the words overwhelmed. So it's hard to pinpoint exactly what I said in a span of, a number of different visits.
Did you indicate that there's information on the website that if a person has an emergency that they should do something?
I did, and I advised her the same.
So basically, if one of your patients becomes suicidal, and on that note, did she tell you at that point, up to November of 22, that she was dwelling on suicidal thoughts?
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records to see when she first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
It's kind of like being a fisherman out in the ocean who's worried about the possibility of a storm and is thinking about the storm and is dwelling on the storm, almost in fear of the storm, right?
No.
Isn't it?
I guess.
So when she tells you that she's, and I don't know what to do, what did she say? She's having suicidal thoughts, or what did she say? Close to it?
She denied having suicidal thoughts, but felt that she was getting close to it.
Okay. So she was dwelling on it or thinking about it, right? Is that fair?
She was fearful of eventually having those kinds of thoughts.
To kill herself.
Yes.
And how frequently were the thoughts?
I'm not sure exactly how frequent they were.
Did you ask her?
It's very likely that I did ask her the frequency.
Wouldn't that be in your medical records? When you see some patients, you have some patients other than Lindsay Clancy at that point, right?
Yes.
And you document when a patient, my God, when a patient comes in and tells you that she's in postpartum distress and she's close to having suicide thoughts to kill herself, that's important, isn't it?
It's important that I am aware that she's having these thoughts,
What thoughts?
that that she is fearful she could become suicidal.
And she told you, I imagine, or you asked, how frequently these thoughts were.
I don't have it documented how frequently they were, but that is a question that I usually ask when we're talking about suicidal
When
thoughts.
we're usually testifying in a murder case, we usually have facts that we can tell the jury, not speculation.
Objection. Yeah, sustained.
Did she tell you, or did you ask about suicidal thoughts?
Yes.
What did she tell you? If you don't know, tell us.
No, I know, sorry. But it's what I said before, that that she denied having them, and she wasn't having them, we were meeting, but she felt close to it, close to having those thoughts.
Okay. So would you agree with me that many times patients, especially psychiatric patients, may minimize their symptomology?
Patients sometimes do.
And sometimes when a woman has just had a child and has other little kids at home, they're worried about the government taking kids away from them, because you're a mandated reporter, aren't you?
Overall.
You're a mandated reporter, aren't you?
I am.
And if she told you, I'm having suicidal thoughts, I'm close to it, homicidal thoughts, you'd report that, wouldn't you?
Not necessarily. I think it really depends on the context, but having suicidal thoughts alone is not a reportable condition.
All right, so basically, we know that she was close to having suicidal thoughts to kill herself, whatever that means. We don't know how frequently she was having them. Yep.
Today, I don't know how frequently, but at that point, I believe I did know how frequently they were.
Okay. So as a result of that, you then gave her therapy, I imagine, right, through the television.
Yes.
And what therapy did you give her in November of 22?
I gave her supportive psychotherapy.
And what does that mean? It sounds great. What do you do?
It's listening to the patient and providing.
Sorry? Listening to the patient, like when they say they're having...
Hold on. Sustained. Next question.
So,
You didn't finish the answer.
Right. Next question.
thank you, Judge. Listening to the patient, that would be when, for example, one of your patients tells you, after all the treatment that you had provided prior to that, all the symptomology that she had, insomnia, anxiety, all of that, that she's close to having suicidal thoughts. That would, I imagine, impact on you.
Yes.
So what did you do with this psychotherapy?
So I provided emotional support and validation
What
and
does that mean? Validation?
encouragement.
What does that mean?
Something like, I understand this is a very difficult time. It really, it varies on the individual.
Sure. How about Lindsay?
I don't remember the exact therapeutic words that I used.
Okay. How long did you give the therapy? How long did you give the therapy? Validation and all that stuff?
I don't remember exactly the duration.
Maybe about 10 minutes?
Maybe
Through the television, right?
through the computer.
So, as we pointed out, you tell the people that come to see you, when I say you, I mean collectively Astor Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right? Look up the number?
We advise them to call 911 or go to the emergency room as quickly as possible.
How about suicide hotlines? Do you give them advice to call them?
That's an option as well, yes.
Sure. Did she call suicide hotlines?
I was not aware that she did.
Did you ever ask her?
I don't think I specifically asked that
Well,
question.
not specifically. Did you ask her anything? Did you beat around the bush maybe? Ask her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were in the front line of this, aren't you?
No, overall.
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
And you never asked her if she had ever called the suicide hotline, did you?